Hello, welcome back. So, in this episode, we'll be looking into the causes of speech, language, and communication disorders. To understand the complexity and difficulty to communicate, we need to first look into what causes speech language issues. Be it a child who finds themselves with congenital speech and language issues, or an adult who finds themselves in the crossroad with an unexpected medical condition which results in loss of language. There are multitudes of causes which leads to difficulty in speaking and communicating. Number 1. Premature birth. Preterm babies are at a higher risk for several medical complications compared to a full-term baby. A weak immune system demands that the baby be monitored for a while at the NICU. Care should be taken about the child's feeding habits and monitor all the developmental milestones. Number 2. Birth weight. As previously suggested, a preterm baby or a baby born with less than the suggested birth weight are at higher risk in achieving motor and language milestones. Research has also shown that children with low birth weight were more likely to be diagnosed with speech and language disorders. So, it is important that you identify whether the child is having less birth weight or not to completely evade the reasons for causing language delay. Number 3. Hearing loss. Hearing loss makes the child unaware of the environmental stimulus, which also includes language input from the parents and the surroundings as well. The varying severity of hearing loss will cause the child not attuned to the world of sounds, which leads to language disorder and or a delay in language learning. Number 4. Genetic abnormalities. Syndromes such as Down syndrome, Tricher-Cullen syndrome, etc., are seen to have a genetic predisposition to speech and language problems. Hence, look out for consanguinity and family history of physical or psychological disorders, and do consider a genetic mapping and genetic counseling if any of these criteria falls in your category. Number 5. Seizures. Seizures causing in the early years of life or otherwise is one of the leading causes of speech difficulties and language difficulties, and as well as total or partial muscle weakness. This could manifest in children as delay in picking up language, difficulty in eating, and in adults as loss of language, confusions, and muscle weakness, which in turn affects their swallowing functions as well. Number 7. Dysfunction of vocal cords. Voice is required to produce speech. Conditions affecting vocal cords such as vocal polyps, laryngeal cancer, ulcers, as well as overuse of vocal cords due to screaming, constant clearing of throat, also leads to irritated voice and or partial or complete lack of voice. Number 8. Brain trauma, such as stroke. Injury to the brain due to incidents like traumatic brain injury, accidents, stroke, blunt trauma to the brain affects speech as well as other cognitive functions. Depending on which part of the brain is affected, the severity of the condition varies. Number 9. Neurological conditions and neurodegenerative conditions such as cerebral palsy and dementia. Conditions affecting control of muscles in the mouth due to nerve damage in the brain causes difficulty in speech as well as swallowing. Symptoms include lack of muscle coordination, stiffness, drooling, tremors, etc. So, these are some of the common causes affecting speech and language in the early years of a child as well as an adult's life. Some of these conditions can often be identified early, and an early intervention can improve the quality of life of these individuals immensely.